Hello guys, welcome back to our channel, and today we are back with another video. We have changed the format a bit this time since the counseling is going on. We have the entire team of radiology counselors today here, and we are going to have a panel discussion on how to select a good DNB or MD radiology residency program for you, and what things to see and what to oversee. So, we have our panel. We have Dr. Ayush Srivastav. All of them are ex DNB residents of Kokila Ben Ambani Hospital in Mumbai. So, Dr. Ayush Srivastav, we have the first member, and he is currently doing first year senior residency from RML Hospital in Delhi. We have Dr. Vishnu Pujari, who is doing third year DM Neurointervention Radiology from Sri Chitra Thirumal Institute of Science and Technology, which is a central institute in Kerala, Thiruvananthapuram. We have Dr. Shivam Kotak, who is currently assistant professor in Gujarat Adani Institute of Medical Sciences in Bhuj, and we have Dr. Saksham Yadav. He is a consultant radiology in Lucknow and also owner of two radiology startups. So, guys, let's begin. Let's just talk about what all things a aspirant should see. So, I think the first thing is size of the hospital and what is the infrastructure like. Insights, guys.
So first of all, I think you should look for how many bedded the hospital is, because especially in DNB, it's important that if you're working in a hospital which is less than 500 bedded, then you will have to do one extra year of senior residency to get an AP post in a medical college.
Okay.
So try to aim for a hospital which is more than 500 bedded, and also you should look for a hospital which has a good multi-speciality and where different specialties are good. For example, if in a hospital the surgery department is good, or if it has a good neurosurgery or urology, then you will get good cases in those respective departments. So you should look out for that.
Basically, I think one should try to aim at a more general sort of hospital rather than a very specialized hospital. Say you go to a hospital in which there is only cancer, you go to do your residency in an oncology
Yeah.
hospital, then you'll obviously miss out on general cases. So try to see whether one easy method is to go to a hospital's website and see what all departments are there. The more diverse the department mix is, the better your residency will be. What about you guys? Anything you want to add?
Yeah, also I think many times it is difficult to get the information about the colleges or the hospitals. Like I remember from my days of counseling. So what you can always do is you to try to get the number of any resident, and if you're not getting any context, you can directly call up the hospital or maybe the admin department or the admission committee of the hospital and get the number of any resident. Generally,
true.
they don't hesitate and provide you with one, and then you can communicate with them, or maybe you can, if possible, definitely, then it is definitely good that you visit the hospital once before joining. All the options, the major 3 or 4 choices that you want to keep, and then you visit all the areas and the things which we are going to discuss now. So you can, that is always best.
Another thing is infrastructure of the department. Like what all things a aspirant should see in the department, like in terms of machines and in terms of procedures and everything. What do you guys think?
I think at least from my point of view, at least there should be 1.5 Tesla MRI machine and a good CT. This CT and MR there should be there for a radiology residency program. Without, I think, without CT and MR, radiology residency is not like a good program to be there. I think ultrasound, each and every government and DNB hospitals are having. So main thing, my point of view is that CT and MR should be there. If a radiology residency, like if we consider it to be a good, then at least 1.5 to 3 it is
Yeah,
Tesla of
1.5
MR.
Tesla MRI will be good enough. I think another thing is that don't go for okay, we want a 512 slice CT only. It's like camera only. The more number of megapixel does not translate into a better picture quality. The same goes for CT. A 16 slice CT is also capable of taking really good images. But yeah, there should be diverse cases. I think the only
I feel all the modalities should be there. Then after that, it depends on the case load and the case variety.
Yeah, actually. Another thing, Dr. Shivam, you were telling about X-ray procedures and all.
Yeah, so I think also in all the modalities, maybe you can focus on what like quality or the type of work and the type of scans that are done. Like in many institutes, suppose fluoro is not there in many institutes, so you perform the procedures on X-ray. If fluoro is there, then that is an add-on benefit. Also, in many institutes now, CT has taken over many barium procedures which used to be done previously. So if procedures like barium, HSG, I think IVP, RGU, MCU, if you get to do those, then it is definitely better because still MCU, RGU, and few of the things, barium swallow, they have no alternatives. So if you get to do those in residency, then definitely it is better. You have to perform those in your private practice as well. So
One more thing that I think
So
prospective MD students should try, because most of the MD programs are there in the government colleges. So just see whether the CT and MRI machines is in public private partnership mode. So in many of these colleges, on paper you will see that okay, we have 1.5 Tesla MRI, but that will be in a PPP mode, and then in that case you should try to find out whether the residents get the exposure to that MRI machine or not, because most of the PPP modes will be doing tele-reporting, or some consultant will come and just report of all the cases, and you will not get exposure. So I think that is also important. Okay, and another thing is that whether residents do preliminary reporting or not. That is another factor. Uh,
Yeah, exactly. And that is the main point in residency because if you're doing like USG, so you should look at you are how many USGs you are getting to do. And the other thing is not only doing USG, but is someone checking the USG which you are doing. And even after doing USG, like are you getting to write the report of that the scan you have done,
True.
and it has been checked or not. And the other thing which you have to see is like are you doing ops also? Is the program that you are going to do ops? MSK is also important. If the institute is having MSK USG, then that is upper hand. Like many of the government or many of the institutes don't have MSK, so that will benefit you. So these are the thing. And if you are in small interventions also, USG guided intervention you are getting, so you can ask these things and look out for. If you're getting in hand, then that is very good. Even in CT also, that cross section, same thing applies. That is some consultant or your senior or somebody is checking the reports which you are writing. Are you getting to write the provisional report or not, or you're just sitting and then
Observing.
you will be more observer. So
as
that is
Dr. Saksham mentioned that making a preliminary report, it is very useful because when you are making these reports, you will read some 7 8 articles, and eventually your knowledge will increase. So it has, I think, and that report should be cross-checked by your senior or some sort of a consultant, like who will correct you if you are wrong somewhere. So this is, I think, one of the most important point which we have to see.
Yeah, preliminary reporting I feel is very important. Somebody needs to check your report, else it's of no use. Else you'll come out very overconfident, even while you'll be reporting wrong.
It will
yes,
increase your confidence.
yes, yes. So I
And
think that is the one thing which will make a lot of difference in your life as well. Because in the beginning itself, if someone is there to guide you and to tell you where exactly you fall wrong or what things you should mention in the reports, then that will be kind of a rapid learning. Maybe you can learn those things later on also by self-reading, but
yeah,
then again that takes time and
it
then
will take
takes
time.
that takes a lot of follow-up and everything. So if you are getting to learn from someone's experience, just like in all other branches in medicine surgery, then definitely that is useful. And I think that can be done only by the correction of your provisional reports or reports that you do.
Yeah, another thing that comes up a lot during these days while selecting program is that whether a particular department is toxic or not. Now, what defines toxicity? Like, I think the things you should try to ask for while evaluating for a toxic department is not just in general, just ask the resident that how are the faculties, are they like really cranky all the time, do they like rag the residents a lot, how's the respect level, do can you interact freely with the faculty or not. Things like that. Do the residents get leave easily, or do they get do they get shamed for taking leave? A lot of faculties will tell, hey, why do you want to take leave and all that. So yeah, there should be a healthy work environment, and yeah.
And you can ask like resident from some other department also. You will have a neutral point of view. I
Yeah.
think that is also one of the
Yeah.
important if you want to have a proper information.
Yes, yes.
And
What?
another and one more thing that I would like to add, that some degree of toxicity will be there in every department. I think all the colleges won't
Yeah.
have perfect set of faculties. One or two faculties will be a bit toxic. That you will have to endure, and I think, yeah.
So I also think that sometimes like there can be two types of toxicity. Like there is a work toxicity or a work burden, which many people
Yeah.
are afraid of. So I think that is somewhat maybe you can kind of ignore if the rest of the things are good, because you should work hard in residency. It's not that you are just working without learning something. If it is like that, then it is harmful maybe. But if you get to learn and you have to work hard till late at night, because many times while taking up radiology residency, the mindset is like that I should be free in the evening or something like that.
Hmm.
So I think maybe that's good for a long term life goal, but for residency that might not be helpful. You should stay in the department like we all used to do even after
Hmm.
our working hours. I remember me, Saksham, Vishnu staying up in the department and trying to get to learn from the cases of the postings which we are not posted, or the other modalities which we have not seen during the daytime. So definitely you should try to grasp as much as possible during the 3 years tenure that you get, because radiology is a very vast subject, and to learn all the specialties also during residency is, I feel, you cannot be
Hmm.
master of all, but definitely you should try to learn the basics, and that will require commitment from your part as well. So that is one thing about the work burden. Apart from that, as Dr. Sachin told that your colleagues, your consultants and all, they create a healthy work environment, and you get to learn, as well as you are free to ask the doubts, because many times you are afraid of asking even your seniors about the doubts. So that is a good healthy learning environment which is required, so definitely that should be there.
Yeah, true. Coming to the next topic, I think one more thing that you should try to see is that how many consultants are actually doing some level of subspecialty reporting. Dr. Ayush?
Yeah. You basically learn throughout your residency from your consultant. So if the consultants are good in a place, then definitely it's going to create a much more better environment for learning. And you should see how many consultants are there and how they are, and whether they do subspecialty reporting or not. If there is subspecialty reporting, then you get to see a much better quality report rather than people who are reporting general stuff.
Yep.
And yeah, you should look out for whether there is subspecialty like MSK reporting, fetal is there or not, and
Neuro,
all those things.
like someone is specializing in
Neuro
neuro,
is there.
someone in chest.
Yeah.
Yeah, actually, that that is not like really paramount, I think, but it is always better to have it, because as Dr. Shivam mentioned earlier, that if early in the start of the career you learn from experiences of others, then obviously then you get a head start. Anyway, you are going to, if you are committed enough, you will learn those things later in your life. But yeah, if you are getting a chance to learn from the masters, why not? So yeah, if they are doing such specialty reporting, that's a plus. What else? Intervention radiology. Dr. Vishnu, what about intervention radiology?
Like some students join radiology just because they want to do IR, interventional radiology, later in their life.
Yeah.
So I think if for such students, I think there should be at least, from my point of view, there should be at least 1 to 3 months. Some of the colleges in government colleges, some people they are having 3 to 6 months of exposure
Yeah.
of interventional radiology, whereas in some institutes, corporate institutes like DNB hospitals, they are having some at least 1 month of exposure. So because I am doing DM in IR, what I'm thinking as a radiology, or like each and every diagnostic radiologist, they should have IR exposure, because there they will, in diagnostic radiology we don't have direct patient exposure except for this taking history. But when we come to interventional radiology, whole life changes. You will interact with patient, you will see, you will take history, you will treat them, you will see how like their diagnosis changes, and even your mindset changes.
Yeah.
Being a diagnostic radiology, you are reporting that scan, but being a IR, you are now directly treating that patient. So you yourself, you are responsible for whatever that things which is like that patient is feeling. If suppose your procedure is successful, but somewhere post procedure management went wrong, so you will be responsible. From that point of view, I think we should have at least 1 to 2 months of IR exposure, where they should have some CT guided procedures, ultrasound guided procedures, cath lab exposure for 15 days. Basic, they should have some overview exposures of each and everything. And FNAC and CT guided procedure, I think that is easy, and this institute should allow diagnostic radiology.
Also, one more thing I think I would like to add, that having exposure to intervention radiology, even when you practice diagnostic radiologist, makes you a better diagnostic radiologist only at the end of the day.
This is important
Because
point.
like in SR ship, I was immensely exposed to intervention radiology. I assisted in bronchial artery embolizations. I assisted in thrombectomies. So I know now that if a certain case of hemoptysis comes to me and I am reporting a CT, I make it a point that I do bronchial artery mapping. I tailor my report as the way the intervention radiologist would want. So that is also a plus.
So, for example, I'm doing this neurointerventional radiology. Suppose this stroke case comes. If we are taking the CT angio for this stroke, so we there like if we, I'm telling from diagnostic point of view, what is the clot burden score? How much length of clot is involved? What is the like? Is there any calcification?
Yeah.
So if you are in IR, you will see all these points. But if you are in diagnostic radiologist, you will not see all these points.
Yeah,
So,
true.
like being a IR, you will see extra some 3, 4 extra points, like which that from that point of view, you should have some IR exposure.
So IR exposure is a plus. Dr. Saksham, anything else you would like to add?
Yeah, exactly. Actually, like I also worked 3 years as hardship in SGPGI Lucknow. So here intervention is very nice. Like even the second year resident also, they are like pro in doing PTBDs and all other
Yeah.
things. They do as if they have done a fellowship.
Same happens in
So
AIMS Patna. Yeah.
so that is important, and like that part was little missing there because we were not allowed to do so many PCDs or intervention. We did some CT guide biopsy or FNACs, but I think that part should be more. And when you are choosing like institute, then you can consider that at least that institute is allowing you to do some basic procedures. That is my point.
True, true, true.
Especially for those who are interested in IR.
Especially
Definitely.
for those who are interested in IR.
Yes.
True. What else? What else makes a good DNB or MD program? Anything
There
you
should
guys
be a
would?
good tax, or
Yeah.
like there should be a way to see the reports and stuff.
Yeah.
PACS also, like PACS is basically like all your scans, they are like getting stored there. So suppose if you want to correlate something, now like you have reported some scans, and later after 15 days or 20 days you got that surgical HPR report, histopath report. Now later you can go back to that scan again, you can see your report, you can correlate. It will eventually it will improve your reporting standards.
True.
One of the important thing. And the second thing is like if you are having packs, then you will have these scans for a longer time, for years. If you are not having scans, then each and every 15 days, then it has to be restored, deleted.
Okay. I think, yeah.
Then I think
Another point that we can discuss is academics. So, what actually constitutes a good academic environment in an institute? So many people think that it's all about didactic lectures and having seminars. Now, my point of view in this regard is that having a seminar daily will only make the residents sleep. Didactic lectures are not just what actually helps the residents is there case discussions happening or not
This
in the
discussion.
department, is there interdepartmental meets happening or not in the department, because that is how you learn, by presenting cases, by discussing cases, by discussing cases in the interdepartmental meets, not by presenting boring 1 hour PowerPoint presentations. What say, guys?
yeah, that
Same,
is very
same.
important. Like even in our institute, everyone will agree. Like most of the consultants, what they did, rather than like we having long lectures and all. They just called everybody and they taught from the in the console itself. They
Yeah.
told ki what is important to write, what is not important, what you have missed, what you have not missed. So this is much more important, like case based
Yeah, case-based
education.
learning is much more
Yeah.
important than having seminars
Yeah,
and lectures.
feedback is very important, and whether someone cross checks your reports or not, that makes you learn.
Yeah, true, true.
So I also feel what is important is to be a good radiologist, you need to be a good clinician as well. So it
Yeah,
is not something like while taking up radiology, the most important thing you should remember is that you are not moving away from the clinics. Rather, you should be more aware of the clinics to be a better radiologist, to provide details better to the treating doctor, and also help and guide the patient for further treatment.
true. Another many people in our comment section these days are asking that, sir, MD at a peripheral college or DNB
Yeah.
at a good institute. I think in all our videos we generally discuss this, but then again to reiterate the same point, always DNB in a better hospital than MD
Yes.
in some bad peripheral college. Just for the name that अरे हम तो MD है. That doesn't matter, guys. I mean, it's only a ego massage. If you just want to become a MD and stroke your ego, it doesn't matter.
So, like sharing from our experiences is that only in some remote places or in some medical colleges there might be some differentiation and discrimination, but most of the places have like equalized things,
Yeah.
and NB has also given official notice that it is equivalent. Only I think the only scenario where you might feel discriminated is if your hospital is less than 500 bedded, and then you might have to do 1 year extra SRship. Otherwise, everything is same and everything remains the same.
Yeah, so,
So
okay.
So yeah, personally,
I
like we didn't feel, I didn't feel anything like that. Even like very people coming from very good institutes also. Like it all depends what you are learning from your institute, and that discriminates
yes.
you there while you are
Yeah.
working with your colleagues. That
So
discriminates
from
rather
job,
than
yes, yes.
For
So
my
from
what
job
I think.
perspective in private, I don't think it will make any
It does
difference.
not matter. Like when I interviewed for corporate hospitals
In
don't
fact,
give a damn about DNB or
no, no,
MD.
I feel in fact they might prefer you if they feel that you are
Yeah,
done from some good institute or a renowned institute like Apollo
they
or
might as well prefer
NHA or
you. True.
Induja or Kokilaben. Definitely they would give you a better like uh, chance over other candidates, because
Yeah,
ultimately if you need to work in corporate or in private sector, they are also aware that the pattern of working, if you are aware, it is definitely better. You have been polished very well regarding how to treat, how to deal with the patient, and how to deal with the colleagues and everything. So these few things are like add on. You learn professionalism more in these institutes.
yeah,
So
true.
yeah.
So what is important is like how confident you are after this 3 year of program, rather than going for MD versus DNB. Like in ultrasound, in UHG guided procedures, ops, in CT, like how much confident, any CT perfusion is there? What are the advanced techniques in your institute? In MRN, what are the advanced techniques like spectroscopy, fMRI? So you have to see all this aspect, not just MD versus DNB, because outside when you are working, like when then people will ask this type of standard reporting rather than just MD versus DNB. So
Yeah,
basically, your confidence matters more than your degree
yeah, true.
when you go out.
Yeah, because at the end you have to be a competent radiologist who is giving good quality reports. Nobody is going to see in the bottom of your report that Dr. XX MD radio diagnosis from this college. Nobody. If you
Yeah.
are reporting consistently good, then nobody is going to care.
Also two things I feel. One is that now many people know that DNB exams are relatively tough than MD. I
Yeah,
think
true.
most of the people are aware of that. So definitely that will also help you if the one who is giving you a job or who is doing your interview, if he is aware that yeah, DNB exams are a little bit tough, then he is assured that you will definitely have a basic knowledge because you have passed those exams. Because in
True.
many private institutes generally the failure rate is almost zero, so you will definitely pass those exams, but in DNB you can't like pass easily, so you need to have some basic knowledge. So that is one thing, and the other thing is this is also an add-on benefit that you will have to study something to pass the exam, because many times what I have seen is that if while entering the residency itself you are relaxed that yeah, I am going to eventually pass, then it sometimes make a difference in the attitude of learning.
Yeah, in
So
MD it's kind of easy to pass
yeah.
mostly.
So sometimes exams are like a kick to study some basic things that
Yeah.
yeah, I have to know this, I have to know this, otherwise I might fail. So for
And
some people it might not apply, but for some, or maybe for broader of us, it applies that yeah, definitely exams give a push to study more or work hard more. So
coming to the topic of passing, yeah, one more thing that you can look in a program is that whether at least 1 month of study leave the program is giving or not. That is also important because you need at least 1 month to study dedicatedly. You can
I think yeah, it depends on the intra-departmental environment as well, like mutual cooperation between
Right.
the
Yeah, yeah.
seniors and juniors as well. How much cooperative the juniors and the colleagues are to
Yeah,
help each other
because
out.
sometimes the department will ask you to come, but then in the department you won't be working and just studying. Even
Yeah, like
Yeah,
we
yeah.
will be
that will do.
monitoring things. Yeah, like I think we all also used to cooperate amongst
Everyone does
us.
that.
Like we used to share duties or reporting in such a way that at least one or two of us get time to read or something like that. So that is okay. That is relative. But yeah, definitely if you get some leaves, then definitely that is better.
True. Okay, guys. I think we have comprehensively discussed everything. But if the viewers feel that we have left anything and they have any questions, they can always ask us questions in the comments, and we'll definitely read it and try to answer it.
Also, I want to add one thing that in many peripheral MDs, so what happens is that there are not too many faculties. So suppose you are stuck between deciding between the peripheral medical college. So what I feel is that it is not always the senior faculties which might help you a lot, because there might be a age gap or something like that. Many a times, if there the number of SR, or if there is a good SR, definitely that will also matters a lot. So if medical college, if you have to choose between two or three medical colleges, then definitely you can look out which medical colleges are like hiring SRs, because in many medical colleges what they do is that the work of SR is done by teleradiology.
Hmm.
So also you can try to check that. That happens a lot in peripheral medical colleges. So if there is an SR, like we were lucky to get Dr. Sachin with us. So we got to learn a lot from him.
My pleasure, guys.
Yeah, so obviously senior faculties will guide and all, but an SR will be with you day and night. So
Yeah.
during duties and everything, during emergencies and during making tough calls and taking decisions, and during your night outs when you have to call someone, I think SR matters a lot.
I agree.
So
I
in
agree.
Going to
many
write.
colleges, the bulk
Even I
part
was
is
fortunate enough to have a really good SRs in my MD.
yeah. So in many medical colleges, what happens is there might be a visiting faculty or a tele-radiology facility which will remove the bulk of the cases, and only filtered cases will be reported. So that is
Yeah,
also
true.
something which you
That's
can
a
ask
really
for,
good
and you
point.
don't get to know until and unless you ask in detail about that. So that happens a lot in peripheral medical college, because the number of medical colleges and the number of seats is increasing a lot. So definitely not all medical colleges will be having a lot of faculties, but yeah, the ones which hire SRs or are constantly try to hire an SR will be definitely above all of those who are like using tele-radiology or visiting faculties. A faculty who sits with you and who is with you throughout the day, and if possible during the night, definitely will help you to learn a lot.
That's a great
Otherwise,
point.
apart from that, it is all obviously a lifelong learning process, but I think this thing might matter a lot.
Yeah. Okay, so see you in the comment section, guys. Also, I was seeing the channel analytics. Most of the people who are the viewers are not subscribed to our channels. So please, please, please subscribe to our channel. It will help our little channel grow. So please do it and share it with your friends who are going for the counseling. Chalo, see you in the next video. Bye,
Okay.
guys. Bye.